Welcome to yet another insightful session and webinar with Lead Square. Today's topic of discussion is Digital First Patient Obsessed, the new model for hospital growth. India's hospitals are at a turning point. The era of paper files, systems, and one size fits all care is fading fast. In its place is a new model, smarter, digital first hospitals where AI, automation, and integrated systems work together to deliver faster, safer, and more personalized care. This webinar brings together hospital leaders and digital health experts to explore what it truly takes to build a digital first hospital in 2025. From AI assisted diagnostics and remote monitoring to cloud native CRM and patient engagement platforms, the webinar aims to unpack how hospitals are using scalable SaaS based systems to modernize care, reduce friction, and future proof operations. We have a great set of panels with us, and I would first like to introduce them and then we can dive into the discussion. Firstly, we have Dr. Radhakrishnan Rao Sagi, CEO Renova Hospital, an orthopedic surgeon turned CEO, building value-driven tech-powered hospital ecosystems grounded in ethics and patient-first care. Next, we have Dr. Ashok Thiaka Ranjan, CEO Meridian Hospital, a global voice in healthcare and strategy, blending businesses, marketing, and innovation to unlock sustainable growth in the sector. We have Dr. George Noel Fernandez, CEO, Kamalnayan Bajaj Hospital, a globally recognized healthcare leader with over 26 years of experience, renowned for leading critical care operations and international medical missions. He is currently the chief advisor to the Government of India's Niti Aayog program. We have Dr. Jyoti Mishra, Medical Director, Fortis Healthcare, a seasoned healthcare leader with over 20 years of experience in streamlining operations and delivering quality care across India's leading hospitals. Lastly, we have Vineet Tiwari, VP Emerging Verticals at Lead Square, a sales leader with 15 plus years of experience scaling revenue across India's top brands. At Lead Square, Vineet helps enterprises reimagine customer experience across healthcare and emerging sectors. Thank you so much, everyone, for joining. I would like Vineet to take over now and dive into the discussion.
Thanks a lot, Ashna, for the introduction, and it's an honor to share the session with all the veterans of healthcare. So I will start with one line of an article which I read last week. It was mentioned that AI and automation are being used to improve the efficiency, accuracy, and the care for patients. And like healthcare has been the early adopter of the technologies. So these three words kind of got stuck in my head. It is improving the efficiency, accuracy, and the patient the patient care. So with this thought, I want to open the session, and first I would go to Dr. Rao. So, sir, you have described your mission at Renova as building healthcare with values. Now, in the world of automation and AI, how do you ensure that the digital transformation, it does not erode the human, like connections in care? Or rather, it should strengthen it.
Yeah, good evening, everybody. Thanks, Lead Squared, for giving this chance to be part of such a wonderful, webinar today. One word answer is augmented intelligence, not artificial intelligence is what I look at. Human intelligence augmented by an artificial intelligence, which I call it as an augmented intelligence, where there is no compromise of human touch, where there is no compromise on the human participation, but that is enhanced by the artificial intelligence. Every tool, every technology which is coming in should actually enhance the capabilities of the human so that the healthcare, particularly compared to other industries, can maintain the human relations, the human touch, the human feel, the human empathy, which is actually required in healthcare delivery. See, there are two things to AI, in my view: the operational thing and a clinical thing. Operationally, whatever efficiency you're talking about can be exceptionally good with adoption of technology. All the advancements in AI should be able to actually give extreme strength for back-end operations, administrative work, supply chain management, human resource management, all that. But when it comes to clinical thing, it should become an augmented intelligence. Human element should be the primary one. Human intelligence should be the primary one, and the AI should actually augment their capabilities. For example, if I'm actually looking at my own OP, I would like to have a system where my patient should be actually trashed by a technology. A pre-appointment thing should happen. Why they're coming in and what are the tests done, and that whole thing, if it comes to me as a summary before I can actually see my patient, it'll save a lot of time. I can actually spend more time with my patient rather than looking at their previous reports, previous records, their test reports and all that, and going through them actually takes more time than actual interaction with the patient. That's where I think the technology can help me cut down on my time spent on non-critical things. The same thing can happen post-appointment because the interaction between the patient and the doctor is the most critical thing in a healthcare delivery to begin with. That I think is actually slowly reducing the time spent by a doctor with the patient is coming down. I think that's one critical thing which we can address with the technology. That's my take.
Great. Thanks a lot. Thanks a lot, sir. For next question, I would go to Dr. George. Sir, you have helped in scaling and it's like planning and scaling up for hospitals across all the regions. So we all would want to understand that what are some of it's like on ground practical ways which hospitals can use in kind of like a technology to improve the patient experience. It may be kind of like reducing the wait time or improve the admission to discharge experience completely.
Thank you for asking me this question. I mean, it varies, as you rightly said, from city to city, place to place. It's a lot depends upon adaptability. I mean, technology is there. We can have the best of technology, which can help guide the doctor, guide the patient. But how much of it is used exactly by the patient? And how much can you really get the patient to really start using it? Many times the patient really doesn't feel any advantage. I mean, even if you have the best appointment system, but the kind of the crowd that you're dealing with, they just come between 11 to 5 p.m. And they all are at the same time, then your appointment system itself fails. So one of the key factors is educating the public, educating the people who are using it, the doctors, nurses, all the medical people, and more important, the public, the importance of all such good systems that will help to connect the patient better, educate the patient better, and be more effective for the patient. So my take here is that it all depends upon which city you are. There's not one solution that fits all. Yes, it's easy to buy a system or a very good system and say, let's start implementing it. But then you see that how much of the system is being used by different sector of people. And then the whole system, might have bought an expensive system. It fails because, again, usage is not there. And either the doctors don't use it, or the nursing staff is not using it, or the patients themselves are not using it. They're not really doing the appointment system. They are not really receiving, they're not looking at their messages. They still want a paper system. I mean, you might say, okay, I've digitalized, I've automated everything. I've given them, they're getting messages on WhatsApp. So in one of my hospitals, I had so much of difficulty because everybody said, मुझे पेपर चाहिए, अभी मुझे वो diagnosis paper पर चाहिए. So right from the doctor to the patient, They insisted. Though we said, okay, we'll put a surcharge of 10 rupees maybe on, you're getting it on your WhatsApp, you're getting it on your email. So it all depends upon how much we educate the patient to make conscious that this is a much easy system, it's reliable, and also that you will be able to maintain it in a particular database and use it in another hospital wherever you go. So education is very important, and building the confidence that this system will work and is much easier for the complete healthcare providers. Then I think I feel that the patient journey would be really effective.
Thanks a lot, sir. And for the audience, I think there is, a poll which is there. So, I mean, Asna, I'm assuming that you are, kind of taking care of the polls as well at the same time. My next question would be to Dr. Ashok. Sir, you have worked across healthcare, business, and also, yeah, as an academia. So I want to understand, from a system in the hospital, from a system standpoint, what should be the first three things that every hospital should set it right uh, before they start, or they undergo on a journey to digital transformation?
Thank you very much, Lead Square, for having provided this wonderful opportunity. And it's a very interesting thing, and which I have come across over a period of time, the difficulty in implementing the digital platforms or the digital things in the hospital. The first and foremost is that there should be a clear vision in the leadership level, that they should be ready, that they should be prepared to go for it. And second important aspect is that the governance and the digital ready culture, which has to be there from top to bottom. And third important thing I strongly feel is that the cyber resilience and the data integrity. These three things are absolutely important. First, we'll start with the clear leadership. In most of the time, what we see is that in the planning itself, since I do a lot of projects, there is no, they plan everything, ICU nicely, the management plan, or rooms, infrastructure, everything planned. If you talk about the digital one, absolutely there is no planning. After everything is built and done, then there is a keep on they breaking the things and they keep on altering it, and you most of the time you come across that the nursing station or biomedical engineer room, they say that no sir, I don't have that structure to do that. So there should be a clear cut vision from the day one, from the top management. Until unless it is built on the top, it's very difficult in the bottom. And governance and the digital ready, that culture, it has to be there, because mostly it is driven, the entire thing is going towards the doctors. EMR we talk, the appointment system we talk, and the medication we talk, prescription we talk. In most of the hospital where I worked or where I'm currently there, the prescription doesn't go anywhere. It goes to the pharmacy directly, and they go there, and the medicine, everything comes. So that absolute paperless, that comes. And but it is we talk about the back end integration of operations. That's very important in digital, because the non-clinical staff or the support staff, they play a major role. So I think that preparedness is absolutely required. Otherwise, every time, I've seen that pushing the doctors. Doctors are absolutely brilliant. Whatever you say, they will try to implement immediately, except 2-3 things, which they find it really difficult. And it's supportive staff and others. And the third important aspect, I strongly believe that the cyber resilience and the data integrity, which is very important. In the modern days, when we get so many things, it's not easy to implement anything in the hospital, because so many issues are coming, problems are coming. When the patient load is very high, in these areas, the cyber resilience is absolutely required by entire staff, support staff, clinical staff, all these people. You should go all out and implement something. And then the data integrity, which is very, very important. And the top management should implement on it. All the managers, the frontline managers, and also the nurses, they should be trained on this very well, so that there will be a totality. Because when we implement something, it should be from top to bottom. Thank you very much.
Thanks a lot, sir. I will go now to Dr. Jyoti. So, ma'am, you have successfully led the HR implementation and the quality rollouts. Now, if we all have to understand that, okay, what's your blueprint on okay digitizing hospitals, say, I mean, patient life cycle, and we want to understand end to end. So end to end from outreach to admission to discharge, and then the follow ups. If you could help all of us understand on this.
Yeah, thank you, Vineet, for this question. But first and foremost, I would like to add that having experienced implementation of digitalization across healthcare in various hospitals, one thing which I have understood is like this implementation of EHR is not about adding technology. It is about adding patient experience by building processes and augmenting the processes by using technology so that patient centricity is not lost. So when I think of creating a blueprint for digitalization of a patient journey, it starts with right from at your door, uh, using for patient acquisition using your search engine optimized tools, your AI chatbots where various queries can be answered, your CRM integrated platforms for putting that transparencies and starting that communication with the patient. As the patient lands in your hospital, what is required is completely paper-free, interaction-free registration of the patient. They should be able to register in your hospital through a link provided while they take appointments, or through QR codes as they enter into your premises. So by the time they are there at the billing counter, they need not go through the hassle of paperwork. Once patient is admitted in the hospital, there has to be a completely integrated system, right from the prescriptions or the vital, which is taken by the patient, by the various healthcare providers or various gadgets which is put on the patients. The complete integrated system has to be in place. And on the top of it, there has to be very smart CDSS system, that clinical decision support system, which should help in putting the right plans, right care pathway in the patient's journey within the hospital. Next, which comes is the patient experience. There has to be enhanced patient experience. For that, there has to be real-time capturing of any feedback which is there while patient is still there in the hospital, rather than waiting for post-discharge calling or taking their feedback once the patient has gone, so that you have an opportunity to do certain corrections while the patient is still there in the hospital. And this digitalization should also help you finding out the right time, the discharge planning, which is to be done for the patient right from the time when patient is admitted in the hospital. From that time, that planning has to start. And by the time when it is the day when the patient is required to be discharged, all the processes from communication to creation of discharge summary, everything should be in place, and there has to be a hassle-free discharge process for the patient. Once the patient is out of the hospital, there has to be a follow-up, which is again integrated with you. So there are now various gadgets available where you can follow up with the patient, monitor the patient's chronic illnesses can be monitored in a defined way. And any return which is required or any follow-ups which is required can be preempted, reminders can be given, and patient can come back to you. So it's about creating a complete 360-degree process for the patient to create that experience whenever patient has to come to healthcare. Yeah.
Thanks a lot, ma'am. This was really helpful. Now we are talking about adoption of the AI automation, etc. I mean, technology. Second, also it should help us in improving the experience of the patient. And okay, Dr. Ashok, like touch base like briefly upon the alignment of the team, and from there, okay, my next question would be to Dr. Rao. So, sir, if you could help us, understand that it's like what like tools or okay, tactics should be used to drive standardized digital adoption across it's like all the units, and it should also be it's like keeping it's like alignment with the teams, and also the motivation level of those teams basically.
I think that's $1 million question in the healthcare industry, how to actually implement the digital adoption. Basically, I feel it is not a standardized thing at all. It has to be a personalized thing. Each and every organization should have its own plan. The basic structure will be same, but each and every and not even the organization, each and every unit of a hospital cannot have the same thing going, because there are a lot of variables. The number of clinicians, the kind of patients you see, what specialities you run, your patient load, your building, all those things are variables which actually play a role in your digital adoption. So if you are looking at my take, see, we are not very advanced in our digital adoption yet, but we are trying to do it. What I would do is, it's always top down. The top management should be actually ready for implementing it. Then we are looking at not as a whole. We have not looked at the digitization of the entire group or entire hospital at one go, but we are looking at some administrative part, some clinical part to be taken as a pilot, run it, and then we know how the things are, where we have challenges. Once that is done, we can show the results to the entire unit or the group, saying that with adoption of such and such things, we could actually improve the patient waiting times, improve the clinical outcomes, or improve the efficiency of the operations. And then that actually gives us a easy way to convince all the stakeholders. So we are primarily looking at back-end work first, so that the adoption in the clinical side becomes easier. Because I think personally, I feel the clinical adoption of digitization is more difficult than back-end operations. So that is what we are doing now. Back-end operations will be digitized first, then the systems part of it is ready. Then the clinical part will be taken, where both the patient's concerns and the clinician's concerns will be handled. Uh, we per se don't have a complete full playbook of digitization for the organization yet. But hearing to Professor Ashok and Dr. Jyoti and all that, we clearly understand that it has to be there. You need to have a full digital playbook before you actually start implementing it. But that's not easy. I mean, it's quite a task to create the entire thing fast before we start implementing it. So I would prefer to have it, but I would not wait for the entire thing to be developed before I start implementing. So we are doing it one at a time, but there's a larger picture. And I would definitely listen to what other panelists say, and probably the attendees would probably put in their views also to give you some more insights to adoption. It's a most difficult task to do that digital adoption in a healthcare setup.
Thanks a lot, sir. The learning intensity is increasing, and I'm sure that audience are it's like taking a lot of kind of takeaways from this. And in continuation to this answer, I will go again. So, ma'am, I want to ask you again, since if the digital rollout for systems uh, in a standalone hospital versus network of hospitals. So the complexities will also be kind of like different. So I would want to understand that, okay, it's like, what has been the keys for you to ensure that the teams are aligned and these the rollouts are smooth.
So absolutely, you very rightly said that implementing, digitalization in a standalone hospital versus a multi-locational hospital is two different ball games altogether. So if I tell you what has been our and how we have been able to do it, it is actually leveraging three pillars, I would say. First and foremost, involving stakeholders before implementation. So while developing blueprint, if you involve the stakeholders that how the processes are going to be, the adoption become easier by them. So you have to involve them while you are even planning for evolving any digitalization. The second pillar, which is having a strong governance system, but still allowing some level of flexibility at the local level. So in a multi-locational hospital, I would say there is a governance which is there in a certain way. The digitalization has to be there, but they still allow certain level of flexibility at the way templates are to be designed, the way certain user want to see the processes. So they get agree to those templates, they absorb, then their adoption becomes much easier. And thirdly, building certain champions and communicating with the entire team. So these champions becomes your spokesperson, and how easy it is to implement, reflecting the success rates, flashing the dashboards, how is the adoption. So creating a kind of person wanting to do like the other person is doing by reflecting the scorecards. So these are few things which has actually helped in implementing the system across the healthcare. I mean, within multi-locational centers. Yeah.
Thanks a lot, ma'am. So Dr. George, we touched base upon the multi-speciality, and with your experience, you have seen the digital kind of a transformation across like, different geographies. We all would want to understand that what has been the most effective digital tools or strategies for improving the kind of a patient engagement and the operational efficiencies in multi-specialty hospitals.
Yeah, it all depends on kind of, as I said, location, what type of hospital it is. We've had a lot of successes as in greenfield projects where we are able to implement right from simulation to automation to kind of AI. Because in a greenfield project, everybody knows what they're getting into. So the doctor signs up and knows exactly that, sorry, there are no printers in this place. So he has to really ensure that everything is automated, everything is there. It becomes more difficult when you're talking about in a brownfield project where you have doctors who are there maybe for 40, 50 years working in that particular facility. Uh, I think also it's very important for all hospitals to realize today the patient wants to be connected in a 360 way. So getting the information to the patient is very, very important, and ensuring that the patient is connected. What hospitals can do a lot today with digitalization or automation is to really build that loyalty among the various patients, and to ensure that they stay connected, ensure that yes, they get reminders for taking their medications on time, ensuring that we are remotely monitoring their medical condition, particularly when it comes to chronic care, and ensuring if there is an acute episode happening, there is some way the hospital comes to know and the patient is alerted that, hey, you need to come back to the hospital because now you have an issue, and we do need to really look at that. So the patient connect is extremely important, which we are able to do very successfully through automation and digitalization. As the patient starts getting educated, he starts understanding, his visits to the hospital also decreases. His patient care improves because now he is constantly connected with his treating doctor. The doctor has more time to spend to talk to the patient. The patient does not necessarily need to come to the hospital. The hospital can go to the patient, collect his blood samples, deliver his medicines, talk to the patient. More importantly, involve the patient and the family in the patient journey. So we are able to even connect the family so that the family support is there. So ideally, what we look at in our hospitals is that the patient is coming to the hospital mainly for acute care. The chronic care, we are able to really take care of all the chronic care and monitor the patient at his home itself, so in the comfort of his home. This way, we are a big differentiator than many of the hospitals where now a patient walks in for a normal OPD. Where really we are able to screen the patient, and the patient doesn't need to spend time coming and spending a half a day walking into the hospital doing a OPD just for an OPD. We are able to do that through telemedicine, teleconsultation, and other methods. We are able to monitor the patient, understand. And once the patient is in the system, the patient remains in the system because all his information is there. The doctor does not need to really ask, okay, what's happening to you, because he already knows what the patient is suffering from. Unless, of course, it's some a new episode, a new symptom, something new that is happening to the patient. That is exactly what gets captured. So obviously, your consultation time decreases, and also you already have all the lab reports, all the investigations in front of you to make a better judgment. And with AI, you're able to really get a differential diagnosis. You're not going to miss out on something, because what we really look at is that the human error or do no harm comes into play, because now we have algorithms, we've got a lot of systems that are guiding the judgment of the patient as well as the judgment of the doctor, and ensuring that the doctor is treating the patient correctly, the patient understands his disease, and the patient is able to adapt to it.
Thanks a lot, sir. I mean, so this was really insightful. I will move on to Dr. Ashok. Sir, so this question, I'm sure from the audience also, like a lot of people would be interested to know about this. We all know that the hospital ecosystem is flooded with vendors, kind of pitching the AI-powered solution, etc. But as a strategist, how do you evaluate whether a tool truly adds value to the patient outcome, or it's just not another system that add noise? So, yeah, I mean, your thought on this, sir?
Yeah, it's very interesting. As my other colleagues they rightly pointed out, it's not easy like a IT company or anything to implement in the hospital, because we got people right from the front desk guy who does the entry to the high-end surgeons. Everybody has to be integrated in this part. Most of the time, what we have seen is that patients are very happy about the treatment, but they are absolutely unhappy about the experience what they get in the registration process or in the other things which it is being done. So I strongly feel that there are two things. One is that the patient outcome, which is very important, and second thing is that improving the efficiency of the entire staff, entire gamut which has to be done. And when I talk about background, that the integration part, two things is that the real-time decision making is very, very important. I can give a small example. We had a patient with the sternum sarcoma. It's very different and very difficult situation where four surgeons are involved. Cardiothoracic surgeon, and then oncosurgeon, of course, he is there, and pulmonologist, and also orthopedic surgeon. We need to put up a device. So here, that integration and using the technology, you need to prepare a device, and if you put a device, a later date, if the guy is going to have a problem in the heart, how are you going to manage it? So there comes the AI, the tool what you have, the tools and the current technology. It's absolutely fantastic, and the surgery was successful. It went on for 8 to 9 hours, and the guy is very happy, young guy. And this is one area. The other area where I strongly feel, where I've come across with my experience, is that in oncology, today the major question comes. Somebody comes with, for example, breast cancer. What is the treatment? Because everything is already. You can go with the radiation oncology or surgery, or you can go with the chemotherapy. What is right? There comes that intelligent software, AI. Any tool will help you. That it goes through the complete history of all the surgeries. If I say that a patient is of 35 years old, having T2, N2, all this medical terminology we use, it goes through the entire spectrum and gives the right thing. After analyzing it, it says that what is the right treatment for this patient at this particular point of time. At the end of the day, whatever is speak, there are two things I strongly feel that whatever tool we use, it should help. One, reduce the infection rate in the hospital. Number two, with you and I will agree, reduce the cost. Because the competition is so such, and the patients and the way in which the insurance companies and all these things are getting clamped up, reducing the cost, reducing the infection. If any tool which is going to help, I think that is going to be the super duper which can be used. Thank you.
Thanks a lot, sir. I mean, this would be, of course, very helpful to all of us, to all the audience, and to all of us as well. Now, like coming to the next section, I will no. So I'll like request Dr. Rao to kindly like let us know that if you have to paint a picture for a digital first, a truly digital first hospital, and uh, so how does it appear actually? How does it kind of look like? If you have to like touch base upon say 5 6, it's like okay. I would say okay, major, kind of the parameters that if a hospital has to be kind of completely, like digital on all the fronts. So how it should look like, and what are the technologies it should have?
Well, I mean that I think if I know the answer to it, I think I would have already given you a playbook for it. Uh, Frankly, I don't think we have reached a stage where we can say this is how a fully digital hospital should look like, because a lot of tools coming in new, which are not tested fully, and adoption is not fully on, so that we can actually assess. But whatever thing what we are looking at, it always should be a patient-centric thing. End of the day, the healthcare is all about patient and how we are delivering the patient care. And whatever technologies are coming in should actually help in delivering it better, delivering it to everybody, that is accessibility, and delivering it in a affordable price. So the typical three, accessibility, affordability, and things like that, should always be the principle for even the digital hospital, or digital savvy hospital, or digital first hospital, whatever you call it. I would look at an integrated thing where humans' efficiency is becoming better, their effort is becoming better with the tools, and patient is feeling very comfortable in that environment. It should not be actually overwhelmed with a lot of technology being implemented without having any human touch. These are the things which I don't think are yet reached a stage where we can have a lot of metrics to show them, or tell people that this is how it should be. For me, I would look at technologies which can actually reduce the patient wait times, increase the patient-doctor interaction, reduce the critical illness which is missed because of the lack of interaction between all the stakeholders. Those are the things which I would look at for my digital hospital. Nothing more than that as of now.
Okay, so thanks a lot. So Dr. George, sir, would you want to add on this, because this question is for everyone? So we would want to hear your thoughts also on this.
Yeah, I would divide it into three places. One is clinical excellence, patient care, and quality. Now, if we divide all the three aspects and say, okay, in all of them, we're going to do the automation, we're going to do digitalization, we will be able to really have a complete hospital. If we are able to take care of all these three features, in clinical excellence, the focus has to be on ensuring excellent outcomes, better outcomes of the patient. So every patient, we know that yes, and he or she is meeting the international standards of an outcome. And obviously, we are also looking at that the financial expense is extremely low. We're able to really keep the finance down because we are treating the patient with minimum investigations and minimum diagnostics that is required. And we are treating the patient most aptly. So we're not really trying different methods and unnecessarily increasing the waiting time, the loss, average length of stay at the hospital in the hospital. Similarly, when we talk about quality, once you're able to meet all the quality parameters, ensuring that yes, you're monitoring it very strictly, the morbidity, mortality, whatever are your quality parameters in your hospital, you'll definitely have excellent clinical outcomes. And the last is patient care and patient satisfaction and patient safety. Because now, if you're taking care of the patient, you're taking care of the patient's family and involving them in the disease process. And once all this gets automated and all of this is helping the patient, I think so you're going to always get the best outcomes. Thank you.
Thanks a lot, sir. So, ma'am, so would you want to like share your thoughts on this on the same topic?
I think it has been very well painted by Dr. Rao and then Dr. George. I would only say that what I would look at is, completely hassle-free patient journey, wherein technology is able to enhance every patient touch points without replacing any human touch. That is how I would look at it.
Sure, ma'am. Thank you very much. Okay, moving on to the next one, Dr. Ashok. What's one kind of underrated but high impact digital practice which you think hospital should implement?
I strongly feel that we talk so much about the AI, robotics, all such things. The AI algorithm should be used in a better way. Number one is that as a professor, faculty in IIT and IIM, I always talk about these two things. If any technology or any tool, if you are going to examine and predict the fast deterioration of patient in ICU, if we are able to predict with any tool or anything, as the doctors rightly pointed out, a multidisciplinary approach is absolutely required. That will be a very good thing. And the faster image analysis is the other important factor. And most importantly, what I feel is that ER, when the patient come, how to reduce the time in the ER. Most of the time they get dissatisfied. You keep on, sometimes they spend 5 to 6 hours to analyze even one thing and to come to a solution. By the time most of them they get away from the place. So how to reduce the ER time and how to improve the bed utility? Because as a P&L head, I look into these two aspects: how fast we are able to provide solution to the patient in terms of care, and second thing is that the bed utility, so that the patient will be happy ultimately. Thank you.
Sure, sir. Thanks a lot. So, Dr. Rao, your thoughts on this?
Yeah, I mean, I would probably say the same thing, because the waiting times, even personally, I see some patients after 1-2 hours of waiting times are big challenge here. And utilization of resources, as again, Professor Ashok said, P&Ls and all that are important. Basically, if you can really utilize your services, your resources well, where the digital technologies are actually giving you some kind of a help, I would love to take it. What we do right now is we do a lot of data analysis right now, which we haven't done previously. Okay. And I would definitely advise everybody who is looking at running a hospital should have some idea about their own data. How many patients, what kind of patients they are getting, why, where are the challenges from the patient side, what are the clinical outcomes. If you have some data which gives you some insights on a daily basis, then there's a lot of improvement can happen. So what kind of tool you use to gather the data and analyze the data is your choice, but you should always have uh, uh, definitely people should in the top management should start looking at their own data and start analyzing it, whichever tool they want to use it. So that's probably my advice to all the attendees who are coming here, all people whoever actually discusses with this thing. I would ask them to start with collecting their data properly, have a good quality data of their own setup, and then start working on their customized things. So what we do is we actually take a lot of clinical data, a lot of administrative data, and sit on it and see what insights we can get it, and then start looking at a tool which can actually improve it. I think that's what everybody should do.
Thanks a lot, sir. So, ma'am, I'm now like coming back to you again, and this is going to be the last, like question of the session. If like for our attendees, if somebody has to pick one, kind of a principle to guide their digital transformation like journey, what would you advise?
Well, I will advise them to add technology to the processes to enhance patient experience, and not add technology for for the sake of uh, adding technology and becoming advanced. You have to always keep patient centricity in mind, that this is what we have to achieve by putting the technology in place. So that is something which everyone has to remember, that patient experience is something which matters and the technology should be built around it.
Thanks a lot, ma'am. So we will end our session here. So Ashna, would you want to take the questions from the audience?
Sure, Vineet. This was indeed an insightful session. Thank you so much to all our panelists for joining, and of course our attendees. Our audience has shared few questions. Any panelist can chime in and share their inputs. The first question is around implementation. The audience wants to understand if their strategy is ready, but if they're facing challenges, especially in implementing tech platforms in tier 3 cities like Udaipur, how can they solve that? Dr.
Can I answer
Radhakrishnan
this?
has already given his input on the question, but I would request if any other panelists, if they have any input on this.
Only one thing I would like to tell is that address the problem first, select the technology last. This is a very important thing. And as Dr. Jyoti Mishra has rightly pointed out, and most important thing is that co-design the solutions. As everybody has said, it's not easy. It's not easy to implement that, but you need patience, pertinence, and perseverance. It's very important to implement all these things. Thank you.
Okay. If anyone else wants to chime in, otherwise we can move on to the next question. Okay. Sukhwan Gandhi from the audience, he has shared a question. He has a staff, with 15, 20 years of experience working with him, but they don't want to automate. They want to do work manually because they feel more connected to their patient. So how can he obviously, motivate his staff to automate and use more of AI rather than doing like manual work?
Yeah, I think so. It's more of getting the younger staff who have, making them do it and showing the benefits to the older staff. That's one thing that really worked a lot with us. I've been running an institute which is more than 50 years old. So when we introduced this whole system in. The younger doctors, the younger people were able to really start and use the HI system, show the benefits, and then we were able to really increase the utility because everybody started seeing the benefits. And slowly, the older population who were against automation or against digitalization started then understanding, yes, this gives faster data. This helps me to improve patient care. And also, it helps me to retain the patient and it also helps me to see more patients. There's value added to it, both in terms of clinical excellence and in terms of monetary gains. And then obviously the percentage increases. So I think it's a slow process, tedious process, but at the same time, we have seen that slowly we see the number of people who join this company journey increasing because they definitely see benefits. They see that their time is decreased. At the same time, it is monetary gains are much improved.
Thank you so much, sir. Anyone else wants to add their inputs?
I mean, if I may,
Sure, please.
you need to actually show them the value, basically why you should adopt, right? That is one critical question, and whether for their adoption, is it going to really make huge significant difference to your whole system, or even without their adoption, you can actually implement most of it. If you can do it, I think you give them time, actually implement it without pushing them for implementation. Get all the other things done first, and then I'm sure most of the senior doctors would start adopting once they see the value and once they understand how it is done. The reason for not adopting is the apprehension that they are probably not good enough in technology adoption. That you should take it out from their mind. And that can happen when you show them that it is not too difficult to adopt. It is not too difficult to actually implement. So don't start with them, start with others, and then get them next. I think that's what I would do.
Thank you. Thank you so much, sir. Ravish wants to understand how we can reduce no-shows and cancellations, increase the ROIs of marketing spends.
Can you please repeat the question?
Sure. Sir, Ravish from the audience wants to understand how they can reduce no-shows and cancellations, increase the ROIs of marketing spends.
I would like to answer as a student of Philip Kotler. I would like to give that one. See, we call something called the return on investment. Any marketing activity. I'm a very strong believer of marketing. You can do a wonderful work until unless you are not good at marketing. It's going to be very difficult for the hospital. At the end of the day, it's all the promoters. What they want is that the increase in everything, in the number of patients, and also the revenue, all such things. So what we can do is that something called METS is that. METS is the one how to measure the activities. Like which activity is going to give you the results, which is not going to give. Roadshow and all is a very big thing, and there are tools are available. Once again, technology. Please use the technology after doing any program, including a small program like a campaign, camp, or a roadshow, or giving a press meet. Everything is should be measured, and at the end of the day, you have to find out that for your hospital, which one is going to be very productive. Sometimes like places like I'm telling you that places like Kerala, West Bengal, Assam, all these places, one-to-one contact. This still they go on a big tour. They go and meet the people in the society. We call as a community connect. With this, they improve. So METS has to be used. Like which activity is going to give them result. Use the technology. You'll be doing that. And a lot of things have come. I always say that you can use something called Pandora, which is the latest. TikTok, all these things is gone. Pandora is the latest one, which is a very small tool which can help you to reach the public and which can give very good image. Thank you.
Thank you so much, sir. Anyone else who wants to chime in? Okay, we'll move on to the last question of the session. Ashish wants to understand how can we ensure maintenance of digital records? Dr. Jyoti, if you would want to chime in.
Yeah, so I will say there are very robust processes for medical record audit as well as it happens with the manual processes. And also something which is very important is to create a backup. The backup also has to be created and it has to be regularly done so that your system is safe and secure.
Thank you. Thank you so much, ma'am. Anyone else?
At the end of the day, it's about the passion, like the digital records or all such things, right from the entry level, from the security level. I strongly feel till the end, there should be a passion and there should be a integration, and it should be like everyday, classes for them. Because every third call, fourth call, what we get as a CEO is that, sir, there is a new tool available. Would you like to be interested? So the world is going towards that, and people have to understand, and definitely the passion to implement and adopt is absolutely important.
Thank you so much, sir.
So,
With this,
Ashna, I have a
we
question, if I can
yes.
also ask. So, Dr. Ashok, I have a question. Since you mentioned, that market, and we discussed briefly on this, that market has got, all the technologies of the world. Now, once you implement a tech stack, how do you kind of, like check that, okay, so this tech, there is an ROI on this tech. So what, like metrics or the levers has, like moved, what are the, like benefits of this technology, etc. So do you do a check on this, and if yes, how? I mean, it will be, very helpful for the audience also to understand.
Boss, you are opening a Pandora box. It's a big thing. I'm telling you, this is what we are all called darlings of promoters. We know which specialty, how to improve, where to bring it. We know the money spinners. What is to be at the end of the day, it's all rupees, annas, paisas, and whether you use robotics or we use a simple technique. And as I said, to put it in a very nutshell, we call as disease profiling. Nothing to do with the disease profiling. What we talk about that. This is something like that. Each place, each market has got certain things which you can do. For example, African market, you cannot sell anything about orthopedics there, because it's already the guys are walking. They are very strong. Neurology plays a major role. I can tell you, Global Hospital has done a big thing on this. They improved their neurology business in that way. And for another tips, I can give you small, like plastic surgeries, fingertips injuries. If you want to do that, you have to go to the factories area where you have to do that. So what you have to do is that your specialty, we call as that, like pharma guys, what they say is that everyone has got a liking towards something. So you have to find out which will work, which will not work. And absolute important thing is that understanding the basic about the market dynamics, and also the customer identification, which is very important. The market segment, what you work, the customer segment, what you work. I'll give two tips. It will be of very interesting, which will be very confusing. One is that target marketing. The other one is that market targeting. These two things are very important so that you will be very successful. Thank you.
Thanks a lot, sir.
Thank you.
Thank you so much. Thank you to all our panelists and attendees for taking out time for this. I really hope our audience find all of these inputs extremely helpful. And I would request, all our audience to keep following Lead Squared for more such insightful webinars in future. Thank you so much, everyone. Thank you again.
Thanks a lot to all the speakers.
Thank you very much, all the speakers and Lead Square. Thank you very much.
Thank you. Thank you.
Thank you.
Thank you.